Good evening, all. Myself, Dr. Ajit Pillai. Welcome back again. Uh, First of all, I wish to thank all the viewers who have been tuned to the previous sessions. We were discussing some of the important heart-related health topics. So today's topic is also not very different. It is also related to an important problem. Although it is not affecting majority of us, but a small group of um, our population, or maybe our relatives, or our parents, etc. So today's topic is basically tips of heart patients after bypass surgery. So what is bypass surgery? Bypass surgery is, as the name suggests, it is a bypass. So that means the normal passage is being averted or diverted. Okay, so this is one surgery which is commonly performed in the heart. As you know, the commonest problem affecting the heart is actually heart attack or block in the heart vessels. So this procedure is being done for patients who have multiple blocks who cannot be otherwise be managed with procedures like angioplasty or stenting, where a cardiac surgeon, a heart surgeon, opens the chest and he will bypass the blocks by taking veins from the legs, also vessels or blood vessels from the arm. So he uses all these vessels to bypass the existing block. That's how the patient is relieved of the difficulty in the blood flow. So as I mentioned, this is actually a surgery which is done by opening the chest. So obviously, as you all know, the chest is having the chest bones. So those bones have to be cut, and then the heart has to be stopped. Heart is a beating structure, so you cannot, what you say, you cannot keep on doing surgery and suturing in a beating structure. It has to be stationary, then only we can do all the surgery. So we will do a cardiopulmonary, put the patient in cardiopulmonary bypass machine, and we give cardioplegia. So we'll temporarily make the heart stop and then do the surgery, and after that we'll make the heart pump again. And then the wound, or the bone wound, or the bone crack, everything is actually being sutured. So this is a surgery. On average it takes about 4 hours to 5 hours, depending on the number of blocks and the complexities involved. Usually this is done under, obviously this is under anesthesia, and the next day the patient will get removed out of the ventilator and everything, and then second day, third day, recovery starts, and then the end of 4 or 5 days the patient may go home. But following that surgery, it's a major surgery. You are, as I already told you, cutting the central bone of the chest, so there will be obviously a big scar in the chest. And because of the wound pain, breathing may be a problem. So immediately after extubation and shifting the ward, patient will be asked to do breathing exercises. They'll be asked to do chest physiotherapy. Of course, then the doctor's instructions, a lot of doctor's instructions will follow. This is in summary the protocol or the workflow for a bypass surgery. So there may be our relatives, our uncles or aunts or our own parents. One of them in the family would have undergone this kind of a procedure. So now on the topic today, let's go in detail. How, what are the tips or what are the things you should be advising or should be knowing about patients to follow after a bypass surgery? Now, for any surgery, recovery is very important. If you don't take care of the recovery part, then whatever the surgery is being done or however good the surgery be, the outcomes may not be good. Correct. So suppose the wound is there, if you don't take care of the wound proper and it's not healing, it's getting infected, it becomes a big problem. Correct. That is why post procedure rehabilitation or post procedure care is very important for any surgery, especially cardiac surgery. Now, what are the doctor's instructions for this? So generally, the doctors now they all believe in early ambulation. So the average hospital stay comes down. We believe that this technology has been improved, the success rate of the surgery has improved. So they will make the patient even wake up the same day, remove the ventilator tube on the same day or the next day morning within 24 hours. Make the patient cough, make the patient breathe on its own, make the patient speak, and as I mentioned to you, they will ask to start with just physiotherapy, etc. And Very rarely patient stays more than 48 hours in the ICU. So the very next day patient can be shifted to the room, and then doctors will be advising certain infection precautions, like see you have an wound in the chest that has to be healed properly, especially if you are a diabetic, then there is a higher chance that the wound get infected. So all the infection prophylaxis should be given, proper hand washing, don't allow too many visitors coming in, don't allow anyone to touch the wound, etc., etc. Chest physiotherapy is very important because as I mentioned you, cardiopulmonary bypass, I told you, during the machine, the heart and lung function is taken over by another machine. And then after that, your own lung returns, your own heart returns to its function. So during that time, there is always kind of some issues where your breathing may not be proper, or because of the pain in the chest, you may not be able to breathe fast. So, and you'll be restricting the breathing, all these things can happen. So, you will be asked to do chest physiotherapy or breathing exercises. It's very important. Many patients do not follow this because of the pain. So, we will give some painkillers and then encourage them to breathe now, breathe as good as possible. This is something. So one I told is infection. Second, I told the breathing exercise. Third, I told that the bypass, sometimes the vessels or veins will be taken from the legs. So there will be bandages in the legs. There may be pain in the legs. So those bandages will be frequently changed. And also we have to see whether those wounds in which the surgeon harvest those veins from the leg, are those wounds are also clean, are they healing properly, is there any infection? This again patient will also have to be looking at. Leg pain can hum. There may be swelling of the legs because of the removal of the veins. All these things can happen. That also has to be taken care of it. Then early, I mentioned already, early ambulation. What is early ambulation? As soon as possible, patient should be able to walk. What is the advantage of early ambulation? So we walk early. Obviously, the heart is a demand structure, right? Whenever your demand increases, it pumps faster. So we are asking slowly. We are training the heart to pump more by making a walk or making a jog. Second thing, as I already mentioned, because the legs are also affected, early ambulation improves the blood circulation to the legs also. So that is very important for the veins also, which are being cut or removed for the bypass surgery to get recovered. And third thing, if you are a hypertensive or a diabetics, early ambulation improves your blood sugar levels and may not really require long-term insulins, etc., etc. And fourth thing, it will bring you confidence, not only to the patients but also to the family and also to the treating doctor. See, I operated the next day, patients start walking, so the doctor will also be more confident to send the patient home early. So early ambulation is important part of early rehabilitation. Patient, family, doctors, everyone will be more comfortable in sending the patient at the earliest after a surgery. The longer you stay in the hospital, longer is the risk of hospital-acquired infections. That is also very important. The other thing is actually psychological counseling. Generally, these patients are after cardiopulmonary surgery, they are psychologically depressed. Why I had this? I had undergone a major surgery. Will I be able to resume my regular office work or homework, or will I be able to satisfy my social responsibilities, etc.? The surgery is very safe. If you are recovered, you will recover to full functionality in a few days or weeks' time. That is a reality. So again, this has to be re-emphasized. So we have psychological counselors. Doctors themselves are good counselors and psychological advisors. This also will be one of the advice the doctors will be giving to for the patients. Now, the next important thing is diet. Always the patients will ask about what is the diet I should take. Am I able to take the same diet I used to be? Sometimes patient will ask, see, doctor, I was one of the perfect diet. I was on a perfect diet for so many years. How does these blocks have happened to me? These are some of the questions patients ask. So, what is a healthy diet? Actually, the healthy diet means it's an arbitrary term. Somebody feels something is healthy, may not be really healthy for another individual. Because all of us are, especially in our country in India, we are very heterogeneous in our dietary practice. Somebody from the north, somebody from the south, somebody from the east. They are very different dietary cultures and heritage. So on a simple note, I would say that reduce the carbohydrate, reduce the fat in the diet, be moderate in the protein, be rich in your vegetables and fruits. This is an easy way to put it. Now, a person in the south will take more rice as a carbohydrate, whereas a person in the north will take more wheat or roti as a carbohydrate. But both are carbohydrates, so reduce the carbohydrate. Similarly, the amount of fat. Somebody in the south take a lot of fat in the form of oils, whereas somebody in the north will take more of fat as a makan. Again, restrict the amount of fat. Proteins, very important source. Fish. If you are a vegetarian, you cannot take fish. Then what you have? You have pulses, you have soya, and you have very good plant proteins which are available. So that is another way to take. Milk is also a good source of protein. Similarly, I told you importantly is actually wherever, whichever part of the country, you have to take a lot of fruits and vegetables. Very important. Many of the patients, half of the patients who undergo bypass surgery are diabetics. So they will ask, sir, I am having diabetes. My sugars are high. Can I take fruits? Can I take banana? That's one of the commonest questions. Some of the fruits are high in carbohydrates like banana, mango, but they are one of the more pure form or one of the more safe form of carbohydrates. Like unlike a spoon of sugar, so they are much more safe sugars, I would say. But nevertheless, eating large numbers of bananas or mangoes may be something we may not be advisable. But we would say citrus fruits, low sugared fruits like melons, like guava, like apples, all are actually safe. So vegetarian vegetables, especially all vegetables, are safe. Patients will ask, beetroot, is it a problem? Beetroot is not a problem. Beetroot, for that matter, carrot or the root vegetables do have some sugar, especially potatoes as well. But in moderate quantities, they are much more safer than your rice and wheat. So that is one general comment I made about the diet. So is it important to maintain a healthy diet? Yes, it is important to maintain a healthy diet because not only that your heart is benefited, but also your bowel is benefited. If you're taking a lot of greens, vegetables, you will be avoiding constipation, which is very common after a cardiac surgery or a bypass surgery. If you're taking a lot of fruits and vegetables, your vitamin requirements is taken care of. So you don't have to be anyone on any vitamin supplements. Very important. Another thing is actually reduce the salt. I'm not telling that you should avoid salt, but reduce the salt. Salt, higher the salt you take, higher the body sodium content. Higher the body sodium content, higher is a high chances of high blood pressure. The kidneys are sensitive, higher load for the heart because the more the salt stays in, more the water stays in. But at the same time, if you reduce the salt, what happens is body will try to conserve whatever is salt is available, and your blood pressure control is better. Heart will be able to cope with the fluid volume better. That's important thing. Now another important thing is actually water. So unless in special cases where your heart function is reduced, the doctor has told that, see, your heart pumping is low, so you should restrict to the amount of water you take. Generally, we'll advise patients to have drink a lot of water. That will also be a healthy dietary initiative. So that is another thing. Now, what fat is safe? All fat are not safe, but generally, vegetable fat, unsaturated fats, fats which are coming from fish like salmon are good. Animal based fats, saturated fats, whether it is meat or butter or ghee, are not very safe. So, oil based, for example, sunflower oil, olive oil, or the oil based fat which are rich in polyunsaturated fatty acids. Fish oils, especially salmon or sardine, etc., are relatively safe. But again, all fats or oils have fat, so we have to be restrictive with regard to the total amount of fat we take. Then, is nuts good? Yes, nuts are good. Nuts have good source of fiber. They have good source of protein. At the same time, they have some quantities of fat as well. But overall, the nuts are good. Now next we come to the physical activity. How much I should walk, how much I should. So it's a common question patient ask after a bypass surgery. Actually, we will generally say walk to your endurance or tolerance. 15 minutes of walking, regular walking inside the house daily to start with. After a week, we can make it 30 minutes. And then after the second week, they can have outdoor walking. So the 30 minutes walking daily is a very good step. We don't want you to run or walk more distances like 4 or 5 kilometers. Now that's not the aim. Minimum 30 to 45 minutes after. So Actually, the walking or the physical activity starts from day one itself, the moment you are discharged home. The moment you are discharged home, unless you are suffering from infection or any other problem, we'll strongly recommend you to start walking. And as I mentioned, after 2 weeks, you should be walking 30 minutes a day. Of course, there may be problem. There may be pain in the legs, pain in the chest, but slowly we have to pick the better endurance. And other aerobic exercises. Once a wound, chest wound, leg wound, all are healed, you are free to swim. You can cycle. All the aerobic exercises are allowed. Lifting heavy weights, going to gymnasium and lifting dumbbells or weightlifts. Generally, we will not advise in the initial 4 to 6 weeks because these are isometric exercises. They are good, but for the initial period, better to avoid. So this is something about the physical exercise. And another, last but not least, is actually the stress management. So we get a feeling that we are actually sick, we are patients, etc., etc. But nevertheless, once the surgery is over, it is the responsibility of the patients. Also, the responsibility of the relatives that to keep a healthy mind. How do you do that? You do relaxation, mental stretching. In addition to physical stretching exercises, you should do breathing exercises, meditation, yoga, and do mental relaxation techniques. These are very important to avoid stress, and this will help you to recuperate faster and rehabilitate faster to a healthy life, which you had or which you never had before the surgery. So stress relaxation exercises, meditation, and always I tell, encourage patients to do whatever they enjoy. That's the best hobby they have. Someone is happy in listening to music, please do that. Someone is listening to watching television, please do that. So all these things, someone is very comfortable discussing or talking to peer group, so go for community talks and etc. This is very important. Now, is sleep important? Yes, sleep is also important. A good sleep is actually a good relaxation because the entire thinking process slows down. Your brain gets some rest, so it's very important. So it's very important that six hours of sleep is very important. Most of the time, we find that patients after cardiac surgery they lose their sleep rhythm, but this also have to be done. So how you do that? About daytime snaps, um, good amount of physical exercise and walking, healthy diet, all these things will help you give a good sleep schedule. So sleep hygiene is very important. What are the good tips of sleep? Don't take electronic media into the bed. Don't sleep late. Don't go to the bed very late. It make you wake up very late. Start to wake up early that make you go to bed very early. So these are some of the rhythms which will help initially in the circadian rhythms in the body to recuperate well. So to conclude, uh, I would say that actually bypass surgery is a quite common surgery. By and large, it is safe for majority of the patients. I would not say all patients, but majority of the patients. Faster recovery will depend on our attitude, our willingness to cooperate with the doctor's instructions, a healthy lifestyle, physical and mental, stress relaxation, healthy diet, healthy exercise, and a willingness or motivation to go back to the regular life or regular routine life faster. I think that's all. I spoke close to about 20 minutes on this. I'd be happy to take any questions if you have. Saurabh is asking, what's the significance of regular checkups with the cardiologist after bypass surgery? Good, Saurabh. Actually, I forgot this point. Actually, yes. Generally, we see patients after a month, and then if everything is fine, we'll ask to see every 3 months. Now, this regular checkups, one is it's good for the patient because patient is seeing the doctor, and whatever from the doctor side, we will reinforce whatever advice we have given in the initial discharge time, and also make sure that whether the patient is actually following this. But checkups are important, maybe more frequent in the initial period, and as time goes by, it becomes less frequent. Some of these patients who are having other issues like diabetes, like kidney disease, these patients may require a more frequent follow for other illness. Now, unless and until the patient is having uh, again the same symptoms, again chest pain, all those things, we generally do not advise for a regular cardiac advanced cardiac testing immediately, maybe at the end of 1 year or 3 years, to make sure that all the bypass grafts are patent, to make sure that everything is fine. We'll ask for a CT scan or even a regular treadmill test to make sure that everything is fine. Yeah, thank you. Priyanka is asking, how does excess weight impact heart's health, especially after bypass surgery? Well, Priyanka, excess weight gain is basically nutritional. So, and that is probably we may have to control with the diet I told you, less in carbohydrates, less in fat, and then relatively moderate in protein and high values of greens and vegetables and fruits. Weight gain and weight loss both can happen after bypass surgery. Weight gain, it is largely controlled by the dietary modifications and physical exercises. There may be some issues like diabetes, like thyroid disease. If it is there, we'll have to detect and treat them to avoid weight gain. I think largely, I think it's a results from the dietary control. Will it affect heart health? No, it will not affect heart's health as such because weight gain. But the problem is his rehabilitation or physiotherapy may get delayed. If you're putting a lot of weight, then suddenly you're walking, all these things will get affected. But on a general note, extra weight gain is not advisable because heart, I keep saying heart is only a 250-gram muscle structure. It's only a quarter kg. Whether you are 50 kg, 150 kg, this 250-gram muscle has to pump. So generally avoiding weight, maintaining a healthy proportion of weight is important for the heart to function optimally. Yeah, thank you. Kishore is asking, how should heart patient gradually incorporate physical activity into the routine after bypass surgery? As I mentioned, the earliest thing is actually home ambulation. We'll advise you because even the relatives may not be comfortable sending the patient outside for a walk individually or alone. So best thing is actually under supervision of the relative to start walking inside the home for about 15 minutes in the first week and then increase to 30 minutes in the second week. And after 2 weeks, the patient can have outdoor activity and again 30 minutes to start with and slowly building up to 45 minutes. Regular walking in their own pace is the first way to start, then they can be brisker. And after that, other aerobic exercises like jogging, like cycling, all can be slowly introduced. It's all depending on the pain of the wound. As soon as the wound healing, which generally happens in 4 to 6 weeks, we probably will ask that we don't ask give the patient a target. You do this much, you do 3 kilometers. We don't say like that. So once the pain gets relieved fully, we tell them, okay, don't worry. Now pain is relieved. Now you can walk to the maximum possible extent you can do. So it's kind of a precision or a kind of a patient, highly individualistic approach to the physical exercise level. Thank you. Abhishek is asking, why is medication management crucial for heart patients? Yes, good question, Abhishek. In fact, I forgot to mention about this because I was giving the general outlook. Definitely, there will be medications. One is actually for the blocks the patient had. Second is some set of medicines for the blocks not to recur again. And third is some of the medicine may be given for the wound to heal. The wound to heal, the third group of medicines is for a short time. After some time, it may be stopped. But the other two medicines for the problem he already had and the problem not to recur again. I think these sets of medicines are very important. These sets of medicine should be continued. Many of them will have to take lifelong. If you skip for a week or something, immediately nothing is going to happen. But that's not the way to advise. We need to take them regularly because the bypass surgery is not something you are taking out the heart and giving a new heart. The existing heart is actually repaired. So the existing heart only is going to survive pump again for the entire life. So that is loud and clear. Medications, as per the physician's advice, should be strictly controlled, strictly continued. Chinmay is asking, why is quitting smoking particularly important for heart patients after bypass surgery? In fact, Chinmay, that's an important question. In fact, quitting smoking is not important after surgery. Even before surgery, it has to quit. In fact, no clever surgeon will take a patient who is actively smoking for a surgery because smoke and nicotine contained products are like a sticky glue. The moment you open the vessels and all, they will just start sticking. So whatever bypass you do, again the bypass area will again get blocked. So smoking is very dangerous actually. Before surgery also and after surgery, somebody who is a regular smoker, they have a high risk for bypass. They will have a lot of other issues. And after some time, after surgery also, if he smokes, nothing, the same problem will recur. All the bypass will fail. So quitting smoking is very, very important. In fact, we counsel patients, if someone is not willing to quit the smoking, probably we will not counsel for bypass surgery because it's too dangerous. Just continue to smoke. Gaurav is asking, why is staying adequately hydrated important for heart patients post bypass surgery? There are due to many reasons. As I told you, the higher the water intake, higher is the body volume of liquids, and you urinate more frequently. So that along with the water, extra salt in the body will get excreted. Number one. Number two, you're taking a lot of medicines after the surgery. So if you don't take enough water, the drug concentration will be higher. Plus, you need to, the drug also to get metabolized with enough body fluids. The third and most important thing is actually maintaining a, you may be on some drugs which can lower BP, which can, you can lower heart rate following a bypass surgery. So if you don't take enough liquids, you will be dehydrated and you'll be hypovolemic, and that is a problem which can affect negatively your overall, what you say, overall exercise schedule, rehabilitation, etc., etc. So unless you are fluid sensitive, or kidney silent failure, or heart pumping failure is there, you should always take enough quantities of water, even otherwise. So if there are no more questions, we will conclude this sessions. Once again, I wish to thank all the viewers who have joined in. Today's topic was actually meant for a specific subgroup of patients who had undergone an open heart surgery. This video will be available afterwards, so please share with your friends or relatives who happen to have a bypass surgery and in the recovering phase, so that it may be useful for them. And have a good evening, and bye. We will meet soon for another interesting and educative topic. Bye bye.